The way that we do group therapy is simply that the therapist acts as the facilitator. And by that I mean he throws out the subject for people to discuss and then basically allows the clients to talk about that particular subject and how they identify with it. Then if done correctly, the facilitator doesn't have to say a whole lot, just direct the group to talk to each other about particular items and how they relate to them. So group therapy is best done when the facilitator does the least amount of talking and the clients do the most amount of talking.
The way group therapy works is we have it structured in 3 sessions. So the first session is what's called a process group. That's where the group gets together and we ask each individual client what they've done for their sobriety that week. We kind of are able to dig in a little deeper and find out exactly what's going on with the client, as opposed to the way typical meetings are set up. Often the client can be there at the meeting and not necessarily have the opportunity to share. In this environment, in what's called the process group, each client has the opportunity to share their feedback on their experience in their week in sobriety.
The second hour is psychoeducational, and we generally have a topic that we talk about that's been scheduled in advance. On Mondays, we always talk about the 12 steps of Alcoholics Anonymous. On Wednesdays, we always talk about the big book of Alcoholics Anonymous. We also split the groups by gender on Mondays and Wednesdays. This allows us to let the patient or the client talk about items that they might not talk about in front of a member of the opposite sex. So the groups become much deeper and more meaningful during those sessions.
The third hour, which is typically the last half hour of the group, is a meditation period. So each day the groups end with a meditation so that the clients can then leave feeling very peaceful about going about their day.
Research shows that 85% of clients that come to therapy or treatment do not have any concept of a higher power or spirituality. And we try to work with them to accomplish that so they can then work on having long-term sobriety through their spirituality.
It depends. On any given day, we can have a group of 8 clients or we can have a group of 25 clients. But we always split the groups once they go beyond 8. So once there are 8 clients, we divide them into 2 groups because we never like the group to be too large. That way we provide enough time for each client to really receive individualized attention.
We found that having larger groups, it allows people to hide within the group, and then people who are shyer or more reticent or don't want to talk about their feelings or events in their life can hide in larger groups. So therefore we split at 8 people. Sometimes we have groups as small as 2 or 3 people, and those tend to be the most effective. The makeup of the groups are on Mondays and Wednesdays we split them by gender. We have a male therapist working with the men and a female therapist working with the women. On Tuesdays and Thursdays we split them by whether the patient went to our residential treatment program or they did not. People who did not go to our residential treatment program have things that have to be taught to them about something called toothbrush therapy, which is a 5-step method of how they stay sober every day that would have already been taught to those people who went through our residential program.